So for me as a patient research partner in Hippocrates, it's really exciting to try to pave way for new ground in order for patients to have an earlier diagnosis, a more precise treatment of psoriasis arthritis. I mean, if we as patient research partners can contribute to that, I mean, it's a huge milestone that we will be able to participate with.
Right from the start, it was great that we were invited to be part of the writing of the first draft protocols, and I think that's a great start. When there was a first physical meeting, the initiators, they invited 4 patient research partners, which was a unique experience because that really enabled us to be part of thinking about how the project should look like right from the start. It's something that not always happens, and I think that shows really how committed also Hippocrates and the people involved are to capture the patient perspective. And I think from the onset on, patients have been involved in all the different stages of applying, but also the first years that we have now started doing the research. We are part of all the different work packages, all the research projects that are going on. So it's a great experience.
I considered my involvement in Hippocrates really special because it's a very big project and it has good opportunities for results. And it's also good for me personally because I've learned a lot of things and I get the chance to work with all these researchers and specialists in the field. And this helps, of course, my self-development.
The patient involvement in Hippocrates, I think, is somewhat special. I think those of us in Europe are probably a little bit more familiar with working with patients. So firstly, compared to other projects outside of Europe, I think it is certainly different and certainly something that we can, if you like, teach other parts of the world with, you know, the value and benefit of having patients involved in the project. But it is special also because patients have an opportunity to feed back to us exactly their experience of working with Hippocrates. They're going to be evaluating that on an ongoing basis. And I think we learn from that feedback as to how we might be able to do things better. So today, for example, at our annual meeting, we got feedback from the patients that they very much appreciated the improvements, the development of lay summaries, the involvement at a work package level had improved, the communication had improved, and they appreciated that, but they've made more suggestions as to things that they would like to see happen within Hippocrates, which we'll look at and see can we implement that over the next year.
What I liked about this meeting is that we are all a big consortium, and we as patients are given the same opportunities, and we can share our views and we are listened to, and this feels very inclusive for me.
If I compare what we do in Hippocrates, it's really a little bit different from many other projects. So we are really expected to be part of all the different meetings. Most of them are online, but we also have the annual meeting, which is a face-to-face meeting. And it's actually very obvious that all the patient research partners are expected to attend this kind of meetings, to participate, which means that we are invited to all the meetings, and when we are there, we always welcome to ask questions, to provide information, and that's a little bit different. So it's not really up to us, up to the patients that you have to take the initiative yourself, but it's also that the researchers have a real interest in listening to our stories, and they want to know what our opinions are and what we can contribute. So I think that that's really a very good experience so far.